In robotics are there in every field, but in the medical field, this is further advancement over laparoscopic surgery. So here, it is a misconception that some patients who have fear that the surgeon is not doing, robo is doing, there are likely chance of any mishap happening. It is not so. So the robo does what the surgeon tells the robo to do, and what the surgeon controls the movement of the robo. The magnification of robo is much higher when compared to the laparoscopy. And second thing is the three-dimensional view. The laparoscopy has only two-dimensional view. A robo gives a three-dimensional view and feel of the surgical field, what the surgeon is doing. So a three-dimensional view of robo and the magnification of view of the surgical field and the precision with which the tissues can be handled, or the bleeding can be controlled is very high, and the robo what we have in Somajigood Yashoda is the most advanced as of now in the world. And this other advantage of robo or minimally invasive surgery is, even after laparoscopic surgery, the pain that is seen at the port sites by the patients are felt almost for about 3 to 4 days. Though the patient starts walking early, but still the pain that is experienced by the patient at the port sites is very much. But in robotic surgery, the manipulation at the level of the muscle or the skin or the tissues is far less when compared to the laparoscopic surgery. And the error of movement, that is very, very minimal in robotic surgery. So the surgeon controls the movement of the robo, and he commands the robo what has to be done told by the surgeon. The other advantage of robo is we have the instruments which have very minimal movement error. In laparoscopy, there is a high possibility of movement. Here, the movement is very precise. The chances of error because of the assistant's movement or thing is very, very minimal, because everything is controlled by the surgeon. In laparoscopy, there's a cameraman who controls the movement of camera, and there's another assistant who will control the retraction or action. But here, almost everything is controlled by the surgeon. So the command control is with the surgeon here, and the chances of missing out or the chances of error because of excessive movement is very, very minimal in robotic surgery. And the advantage of robotic surgery is, in the laparoscopic surgery, you have only restricted movement of your wrist. So the movement of wrist is only about 80 degrees or 90 degrees. But here in the robotic surgery, it almost replicates the movement of the wrist of a surgeon. So the degree of movement of the wrist is almost 240 degrees. So the dexterity, which is very important, which is not possible in laparoscopic surgery, is very much possible in robotic surgery. And the learning curve for any surgeon in robotic surgery is far less when compared to laparoscopic surgery. So the freedom of movement which we experience in robotic surgery is really good, and that is the added advantage of robotics over laparoscopic surgery. Thank you.